Hi there, it's Tammy here. And in this short video, I'm going to be talking about exercise and mental health during pregnancy. So if exercise factors into how you manage your mental health, and now that you're pregnant, you're actually really unsure how you can continue to train safely to support your mental health, then this video is absolutely for you. And of course, while pregnancy can be a really beautiful time in your life, it's actually no secret that the pregnancy journey has the capacity to affect your mental health. The statistics are as high as 1 in 5 mothers experience mental health problems during pregnancy or within the first 2 years after childbirth. And there are, of course, so many reasons for this. And change and uncertainty actually rank pretty high on this list because as humans, we're certainty seekers. So we don't particularly like change and we definitely don't like uncertainty. And there's actually few times in your life when you're facing such massive change and uncertainty as pregnancy. You know, there's pretty much no corner of your life that's left untouched by change, you know, from relational, financial, professional, physical, and emotional, you know, and that's bound to bring increased levels of stress to your whole life, right? It's also not uncommon for pregnant women to experience loneliness, which is certainly a feeling that we can all relate to and that we know can impact someone's mental health. From a physical perspective, of course, you have things like the shift in your hormones, the rapid and unexpected physical changes that you're experiencing, plus the ever-changing pregnancy symptoms that you can experience on a day-to-day basis, you know, sometimes multiple times through the days. And of course, all of the changes that you need to make to your current lifestyle to accommodate all of this, right? And that's typically where exercise falls into, an area of your life that you need to make changes. We already know the long-reaching positive effects of exercise on mental health, you know. We know that exercise improves your mental health by doing things like reducing anxiety, reducing depression, and negative moods. We know that it helps improve your self-esteem, improve your body image, and improve cognitive function. And that's just a few off the top of my head. But the biggest problem that I see facing women when it comes to exercise during pregnancy are concerns around safety for themselves and safety for the baby, of course, and lack of information, as well as a bit of overwhelm in there too, right? And this is why a woman's exercise frequency typically declines during pregnancy. And this is the total opposite of what we actually need to have happening, especially when studies have shown that poor mental health has actually been associated with increased risk of pregnancy complications. They also know that a steeper decline in exercise frequency during pregnancy was also associated with a faster rate of increase in things like depression and anxiety symptoms. This makes continuing to exercise especially important for those who exercise for their mental health. And a lot of times, people who do exercise for their mental health have specific things that they typically do to help with their stress management. You know, for some, they might go for a run, or they need to go for a run, more like it. But the thing is, for a lot of reasons, most women just don't want to run during pregnancy. And to be honest with you, I actually agree with this, right? Unless, of course, you're a professional athlete, which makes it a totally different story. But for the general population, I think that there are other options that can stimulate the same effect while placing less pressure and less impact on your pregnant body. Especially as we know that, you know, things like musculoskeletal pain, stress urinary incontinence, and abdominal separation are actually prevalent amongst postpartum runners. Now, just to be clear here, I'm not saying that this is caused by running during pregnancy, just that those particular conditions are actually experienced at high rates in women who run during the postpartum period. But then opposite to this, what we know is that weight training during pregnancy may actually reduce the odds of each of those conditions. But the thing is that how does someone who's typically a runner navigate strength training during pregnancy, no less, right? Then, of course, you have those who use high intensity interval training or HIIT to help manage their anxiety. So how does someone who's used to box jumping, wall balling, skipping and burpeeing their way out of their anxiety create that same anxiety reducing response when they're pregnant and they can't do those things? And I'm sorry, but I'm actually going to say this. No, I don't think pregnant women should be doing things like box jumps, wall balls, skipping, or burpees. Why? Because I've seen firsthand the mental, emotional, and physical impact continuing to train this way during pregnancy has had on women during their postnatal journey. And let me just tell you, in my eyes, the potential cost of this actually far outweighs the benefit of doing these things during pregnancy. And the thing is, there's actually so many alternatives that there's just no reason in my eyes to continue doing them. But I feel like if I go down this rabbit hole, I just won't stay on topic. So I'm going to try and get back on topic. And there's one thing that I will say is that these women, the women whose postnatal journey has been severely impacted by their exercise selection during pregnancy, it's these women who drive me to do what I do. Because I know that I can help ensure each woman that I work with won't experience, that same physical impact on their body when they train correctly during pregnancy. And it's really important to understand how you train during pregnancy absolutely has the potential to either positively or negatively impact your postnatal experience, your mental and emotional health during that time. And the key to all of this is actually about finding ways of exercising that stimulate similar stress relief hormones while strengthening the body and helping reduce the pressure placed on the body by pregnancy. And I'm sorry to say this, but just walking or swimming isn't going to cut it for this. I'm sorry. I seem to be apologizing a lot in this video. But when done correctly, training during pregnancy can minimize the physical impact of postural changes, changes to the abdominals and pelvic floor function, as well as help you remain pain-free and mobile as possible throughout your pregnancy journey. All ticks for me. All the while increasing your strength to help you cope with the increased physical demands of your pregnancy, the demands of the birth itself, and life beyond as a mother. Again, all massive ticks if you ask me. So the big question is, how can you continue using exercise to support your mental and physical health during pregnancy when you've found yourself in the void, the void between the known and the unknown? You know that you need to keep exercising, but you actually don't know what's safe and what's not safe. You lack information, you lack education, and you've likely been left to just figure it all out for yourself, And when you exercise for your mental health, this is actually really not a good place to find yourself in, especially as we know the steeper decline in exercise frequency during pregnancy is actually associated with a faster rate of increase in depression and anxiety symptoms. So my number one piece of advice to you, if you've found yourself in this position, is to find yourself a trusted guide to help you navigate this tricky transition. And regardless of whether you're already well trained or you're starting to train because you're pregnant or anywhere in between, that would be my number one piece of advice to you, because I don't believe that going it alone in the gym or continuing to do exactly what you're currently doing or downgrading your training to just walking, swimming, or doing generic one-size-fits-all workouts is actually the answer. I believe to help build or maintain the strength required for pregnancy, childbirth, and life as a mum, the pregnant population need to be strength training. And there's absolutely nothing wrong with getting your heart rate up either, as long as it's done safely. Now, what this guide looks like is going to be completely unique and individual to you as your pregnancy. You know, some people might actually be okay doing generic one-size-fits-all workouts. I don't know. Obviously, as a strength coach who specializes in pregnancy and postnatal, who has pretty much worked one-on-one with this population for probably over a decade now, my preferred option is always going to be, you know, when you're looking for someone to help guide you through this minefield, would be to find a guide that can tailor your training to you specifically. Something more bespoke that matches the uniqueness of your individual journey and takes into consideration your things like your training age, your training capacity, your injury history, all that type of thing. So something that progresses with you as you progress through your pregnancy. And of course, you know, these days this can be done online as well as in person. But like I'm saying, that's just me based on my experience working with this population. But my biggest piece of advice relating to choosing your guide is to make sure that they actually have proven knowledge, proven experience, and demonstrated success in this area. Because there is absolutely a difference when working with someone who specializes in this area. And part of this is actually because when you choose a guide or a coach, you're not only choosing them, their experience, their knowledge, but you're also gaining access to their wider network of professionals. And this can be everyone from things like dietitians, physiotherapists, maternity nurses, obstetricians, doulas, birthing courses, perinatal mental health specialists, lactation specialists, massage therapists, acupuncturists, you know what, you name it. And like the knowledge, the experience, the demonstrated success, you know, this network takes time to build and it's just as valuable to you as the guide themselves, right? And you also want to find a trusted source of information and educate yourself as much as possible. Now, again, each person and where they find this information is going to be individual to them. You know, this can be the guide themselves and as well as their broader network. Or you can find this information in books, websites, programs, you know, there's a lot of information out there, but you've got to make sure that it's from a trusted source. And last but certainly not least, you want to make sure that you find a place where you can connect with other pregnant women. And this is especially important as there's a significant relationship between low social support and the risk of developing mental health problems during pregnancy. So community has a hugely positive effect on mental health during pregnancy. And when you connect with other women also navigating their health and well-being journeys throughout their pregnancy journey, you actually have a shared goal, you know, shared interest and a shared experience. It only increases the positive effects. In an ideal world, you know, the guide that you choose will encompass all of these. So my main advice to you is to choose a trusted guide. Arm yourself with education and find a community for added support as you navigate this tricky time. Because I genuinely don't think that training during pregnancy should be something that you're left to just navigate on your own. It's something that requires a lot of information to be shared about what you're experiencing during this time and support as well. And this is especially important when you exercise for your mental health. It's for all of these reasons and many, many more why I developed the Pregnancy Process Program, a program that provides bespoke, principle-based program design with individualized exercise prescription that's correctly timed, sequenced, and adjusts over time as your pregnancy progresses, all housed alongside quality, in-depth, pregnancy-specific education and information across the core pillars of health, including mindset. This allows expectant mothers to focus their time, their energy on achieving the safest, healthiest pregnancy possible because, we've done all of the work for you. And if you want to continue this conversation or find out more about how we can help you have the safest, healthiest pregnancy possible, just head to the link in my bio or the video description and apply to join my complimentary but private community. So that's it from me today. I hope this video helped, and I'll see you in the next one.